Hospitals across Europe face intense strain from the second wave of the virus. Many healthcare workers are struggling to cope. There are increasing reports of staff suffering from burnout after 10 months of battling COVID. Neil O'Reilly has more.
Under-resourced and overstretched, the battle against the pandemic has taken a heavy toll on medical professionals everywhere. And it's not just the relentless workload. Many doctors and nurses have been traumatised by the suffering and grief they've seen. In Belgium, one medic decided to take on a second job, counselling her colleagues.
When I see girls in the changing room that are 23, 24, and they tell me they have witnessed 4 people die that night, they know by heart the death protocol. And that's quite unusual outside of palliative care units, life-ending care units. I think what impact it will have. It's inhumane to have witnessed so many deaths at that age. And why do those people die in their beds? It's because it's been decided that they will not be transferred to intensive care, because we just don't know how to cure them.
Nolwenn Lebronzes is among those for whom the stress was too much. She gave up nursing to become a pastry cook.
Psychologically, the situation was very difficult. We worked in isolated care units with safety equipment, masks. We had to fight to get a mask, and that was horrible. We took risks for our own safety and the safety of our loved ones. And also all these patients, they weren't allowed to see their family. They were alone, dying alone.
Nolwenn says she quit the job she'd held for 5 years for the sake of her mental health. Several months into her new career, she says it's a decision she doesn't regret. Neil O'Reilly, Euronews.